Having me. There's no place to put my water, so I'm going to put it right there. I want to piggyback just a little bit on what Ted said this morning about holding elected officials accountable. How many people knew that yesterday we had a crucial vote on the next continuing resolution? Just by a show of hands, just guess. We had 5 Tea Party Republicans elected in November 2010. We all worked hard to get them elected. Who are they? Schilling, Kinzinger, right? Helping. Schock, Walsh, and Randy Holkert, right?
And Dole. And Bob Dole was elected in 2010.
Bob Dole. Oh, yes. I don't think of him as a Tea Party. Okay, so let's say out of those 6 guys who were elected, just a guess, how many of you think that they, out of those 6, how many of you think voted against it? Yes. You know who that one was? Same one that always votes against increased spending, Congressman Joe Walsh. Everybody else voted for it. They also voted for the last continuing resolution, number 6 of 7. The bill was called HJR 48. Now, why is this important that you vote against these continuing resolutions? Because if you remember Steve King and Michelle Bachmann, after we elected our 680 legislative seats nationwide, we had our big win, as it happened since 1940, thanks to the Tea Party movement. They were asking, Bachmann and King, that these new reps, when they come to Congress, that since they now control the purse of Congress, which is where spending originates in the House of Representatives, that they don't increase spending, number one, but if they have to negotiate to increase spending, make darn sure that they don't do what? They don't fund what? Obamacare, right? Because Pelosi, remember, put $105 billion into the legislation in what's called auto funding. So it can't be overturned. So our work before 2010 to get these people elected was to stop spending, and most of all, stop spending on Obamacare, right? So Bachmann and King had a piece of legislation, it wasn't legislation, it was just a pledge for all of these reps that when you come to Congress and you are inaugurated as new representatives of the United States in the House of Representatives, we want you to sign this pledge that when the next continuing resolution comes, we want you to sign this pledge that you will not fund Obamacare. So they asked all these new Illinois reps as well. Sadly, only one signed that pledge, Michelle Bachmann. Again, it was Congressman Joe Walsh. When the vote came on March 15th, 2011, remember this, HJR 48, there was a chance to do the right thing. Now, at the same time, our friends on the left, of which I have none, were telling everyone that we have to make sure that the Republicans support the president so that we don't what? Shut down government. We don't want to shut down government because then, of course, our Social Security checks won't go out, our military members won't get paid, and all this hyperbolic crap, right? Well, here's the truth, and here's what should have been done. We should have, on March 15, 2011, and 2 days ago, when the next continuing resolution came along, we should have sent funding for the normal functions of government over to the Senate, but withhold all spending for Obamacare. You can do this because we control spending, right? So then what happens? Now Harry Reid has a piece of legislation that has the normal funding for Social Security, Medicare, Veterans Administration, everything we need except for a penny for Obamacare. And then what would Harry Reid do if it doesn't fund Obamacare? Harry Reid would shut down government. Do you see how you play the game? So instead of doing that, all of our Tea Party reps acquiesced to the lie from the left that Republicans want to shut down government, and they just went along to get along. And that was very upsetting to me, because our House Minority Whip, that's a better word for Peter Roskam, our House Minority Whip, Peter Roskam, and I spoke in November of 2010 for the Tri-County Tea Party. And there was about 400 Tea Party patriots in that room at the St. Charles Golf Club. This is in September of 2010. And Mr. Roskam was so passionate on that stage. It was he, I, and a doctor friend of mine. And he was so passionate, when I get back to Congress, I'm going to do whatever it takes to shut down funding for Obamacare because we control spending, and I'm going to lead the way, and please make sure I get back to Congress. This is Peter Raskin. Fast forward past our November elections to March 15, 2011. Mr. Raskin had a decision to make. Was he going to lead, or was he going to follow? And instead of leading the way and signing the pledge by Michelle Bachmann and Steve King, he decided to follow. And he pushed our new representatives to vote for H.J.R. 48, which was the next continuing resolution. The only man who said no was Congressman Joe Walsh. Every one of our reps said, yes, Mr. Raskin, we'll vote for more funding for Obamacare, more funding so we don't get blamed for shutting down government. So what do we have here? We have a lack of leadership. This is what we have. And the most heartbreaking part is that the lack of leadership resides amongst our very few 5 Tea Party reps. Only one of them is actually leading. The rest are following. So it's not just Republicans we have to hold their feet to the fire. It's also our Tea Party reps. Because when they get there, they have to be pressured by the establishment. Come on, we got to work together. Like Tammy Duckworth said in the debate with Joe Walsh yesterday, we need to roll up our sleeves and get back to work. I felt like getting a guitar up. Kumbaya, roll up our sleeves, kumbaya. That was her answer for every tough question. Working together is not why we went to Congress. This is not why we helped our Tea Party reps get elected. They were elected to stop reckless spending. That's it. And they were elected to stop Obamacare. Okay? So it's not just Republicans, it's our Tea Party reps too. So if you have Mr. Schilling in your district, Mr. Kinzinger, Mr. Schock, whoever they are, maybe you should let them know you're not happy with H.J.R. 48, continuing resolution number 6 of 7, and you're not happy with the last continuing resolution, which was the vote on Wednesday. You're not happy with them funding more government, which includes funding Obamacare. And then you can explain to them how easy it is to send funding over to the Senate for the normal functions of government, but nothing for Obamacare. And then you let Harry Reid shut down the Senate and shut down government. And you know he will. He's not letting that pass if it doesn't include funding for his precious Obamacare, right? So, I had to get that off my chest, because it really upsets me. Okay, now, I'm going to go over with you the 5 biggest lies the president told. 4 of them were to push this legislation through. The last one he's telling right now. And so is Debbie, wasn't that Sergeant Schultz, his soldier. So is David Axelrod. They're all out there pushing the same message. I'll get to what that is later on. First, I want to give you the 4 big lies the president told. The first is, did government make this? The first big lie is there are 50 million uninsured in the United States. Right? Who has heard that there are 50 million uninsured Americans in the United States? Right?
Well, we don't really stay there.
Correct. Correct. Well, that number kept climbing and escalating as we got closer to the passage of Obamacare. And right before it passed, Anthony Weiner, out of left field, which of course is where he would come from, said that there's 100 million people who are uninsured in this country. Right? So what nobody asked, besides just listening to the numbers, is who comprise the 50 million uninsured? Who are these people? No reporter asked that. So I decided to do a little digging. Went with a government data house called the U.S. Census Bureau. See, the U.S. Census Bureau is able to tell us who are the 50 million uninsured. And in 2010, immediately after the legislation passed, then they decided to break down the numbers of who the 50 million uninsured are. So we agreed that there are 50 million uninsured Americans, right? Or at least 50 million uninsured. Here's what the Census Bureau tells us. According to the U.S. Census Bureau, half of the uninsured are temporarily uninsured for an average of 4 months. Now, that means we get to take 25 million right off the top because these are not chronically uninsured people. Here's who they are. I lost my job here. I need to find another job, so I'm going to look for a job. And 4 months later, I'm going to find another job that provides health insurance for me. Are those chronically uninsured people? No, but we include them in the 50 million number. So now we're down to 25 million, right? Who are these people, right? The U.S. Census Bureau tells us, of those 25 million, 38% of them can afford to purchase health insurance, but they choose not to do so. 17 million of them make more than $50,000 a year, and 9 million make $75,000 a year. Are these indigent, poor people that the taxpayer should be paying their health insurance for? If you're making $75,000 a year, go get yourself some health insurance. The few, the proud, the 53% of us who pay income taxes shouldn't be footing the bill for you. You are not truly indigent. So if we break down all the numbers, oh, I forgot one crucial number. You know, they always say the American uninsured. Yeah, 12 million aren't even Americans. They're here illegally. So when we get down through all of the real statistics, the actual number of uninsured is 10 million people. Now, do you think it's possible, just possible, that we can insure 10 million Americans for less than $2.6 trillion? Do you think that's possible? So the real number of uninsured is in this country? 10 million. Now, can we do it for nothing? Can we insure them for free? 2010 cover of Time magazine, they tell us how much medical waste we have in the American healthcare system. The number was $680 billion a year in waste in the American medical system. Did you know that if you ask the government to just be half efficient, because you know they're not efficient at all, but you just want half efficiency, and you ask them to cut just half of the $680 billion, right? And you use that half could insure 100 million Americans with a gold-plated health insurance plan that the CEOs of Blue Cross Blue Shield would be green with envy over for the rest of their lives. So by cutting waste, without spending a dime, we can insure all these people. So if that's the case, what are the 2,400 pages really about? If we can solve it that easily without spending a dime, it's about control. And that is all it's about. And I would approve that to you. The second biggest lie that the president told. We gotta pass this legislation so that, back it up, I lost my place. We have to pass this legislation so that we can lower premiums by $2,500. The TOTUS in chief, teleprompter. Remember that line? $2,500, right? So, I'm just going to tell you, for 17 years, I've been a health insurance broker. 15 years, it was great. I was just a small business owner, helping other small business owners, and then I became evil 2 years ago. And in fact, on Twitter, you will now find me at CSteven, Evil Health Insurance Broker. And the reason I became evil is because, remember, when they tried to pass this, they tried to sell it as health care reform, right? But it was no longer working in the polls to demonize your doctor and your hospital and the American healthcare system, the greatest healthcare system in the globe, right? But what was pulling well was demonizing insurance companies. Because everybody's having a problem with their insurance company. Didn't pay on time, right? Whatever it is. So that was working in the polls. So that became health insurance reform. We got to get those evil health insurance companies, right? So let's go back. He says we got to pass it to save a family of four an average of $2,500. For 17 years, I've had renewals for my clients. Every year it comes. Here's your policy. Here's how much more you're going to pay this year, right? You had a bunch of bad claims, or there were a lot of claims in your zip code demographic. Whatever it is, your premiums go up. Historically, in a bad year, my group clients, 8 to 10%. A bad year was 10% of the group. A really bad year in individual health insurance was 20%. Okay? Since Obamacare passed, I brought with me just a few Blue Cross Blue Shield increases for my clients. Okay? And it's not just Blue Cross, I'm just using Blue Cross because everybody knows Blue Cross. I'm going to go with lowest to the highest. The lowest is 30.17%. That is an annual renewal increase. The second lowest is 31.35%. The third lowest is 35.63%, and the highest I've seen thus far is 44.78%. Do you think it's possible that this employer terminated his coverage? Do you think it's possible that he's going to pay, that he can even afford to pay a 45% increase on his health insurance premiums? No. So what happens when he cancels his coverage because his rates went up by 45%? What happens to the employees who had health insurance? They lose their coverage, which brings me to the president's third biggest lie, which was what? If you like your plan, you can keep your plan, and no one's going to back up. No one's going to take it away from you. Period. That's a direct quote. Who remembers that direct quote? Right? When they lose their health insurance, what happens to those who were insured? The employees. They don't have any more coverage. Let me tell you what that means. Since Obamacare passed, we have lost 20 health insurance companies in this nation. 20 companies have either folded, filed bankruptcy, or were bought up by other larger companies. Why? 6 months after Obamacare passed, one of the most onerous pieces of legislation, because they've been writing new legislation ever since it passed. If you're upset about 2,400 pages, let me tell you that 13,000 more pages of regulations have been added by Sebelius and the IRS since it's been written. 13,000. So they're just going nuts. Let me give you an example of what they've done since it passed. Kathleen Supercilious, our HHS director, she loves writing. You know, she's like an author. She just loves to write. And on August 1st, 2011, she wrote an interim final ruling that stated that every health insurance company in this country must cover abortion. Now, do you remember Stupid Stupak from Michigan? Stupid Bart Stupak was the holdout from Michigan. He called himself a Christian. And he had these Democrat Christian holdouts. And they were not going to vote for a piece of legislation that included funding for abortion. We're not going to do it. They were strong holdouts. And then the president had a meeting with Bart Stupak. And he said, Stupid Stupak, I'm going to write a special executive order, because I love writing that stuff. Because the Constitution is such a pain in the neck. If I can't get this done, I'm going to do it myself. So he said, I promise you, Bart, there will be no funding for abortion in this legislation. I'm writing a special no abortion in Obamacare rule and signing it, Mr. Obama. And Bart said, well, that's good enough for me. We'll come along and we'll vote for it. And it passed, thanks to Bart Stupid Stupak. Right? The president lied. On August 1st, 2011, Sebelius wrote a piece of legislation that said all insurance companies, 1 year from today, what's 1 year from August 1st, 2011? August 1st, 2012. It's already in force. And it's been in force for a couple months now. That says if you purchase health insurance, it must cover abortifacient drugs. What are abortifacient drugs? During one of the debates on CNN, Michelle Bachmann said that abortifacient drugs, or morning after abortion pills, will now be covered on all health insurance policies as of August 1st, 2012, unless we do something about it. Immediately, CNN, the communist news network, they went into spin for their Marxist master Obama and called Michelle Bachmann loco. CNN headline says, Michelle Bachmann's a liar and crazy. There is no RU 486 covered in Obamacare. And they use the term RU 486. Let me tell you how slick CNN is. They're correct. RU 486 is not a covered medication or prescription drug in Obamacare. What is Ella and Plan B.
Is what?
Ella and Plan B. They are two equally deadly morning after abortion pills. So you see how CNN did that? They just said there's no RU486, which is the most popular morning after abortion pill. They didn't tell you that Ella and Plan B were specifically written into the legislation as of August 1st, 2011 by Kathleen Supercilious. So now if you have health insurance, whether you're a Christian, whether you're it doesn't matter. If you're a Catholic, if you're another kind of Christian, if you're a Lutheran, it doesn't make a difference. Catholics specifically are against contraception. Other Christians are against not necessarily contraception, but abortion. But we are all united against using taxpayer dollars to fund abortion of any kind. Unfortunately, it's gotten worse than that. As of January 1st, 2014, there is now an abortion fund where $1 of all premiums collected will be going to a fund to provide actual physical abortions. This has all happened since the President signed his executive order to promise Bart Stupak that there'll be no abortion funding in Obamacare. So please shake hands and let's roll up our sleeves, Duckworth, and work together. Right? This is what happens when that takes place. So, back to what happens when someone loses their health insurance. 11 years ago, I met with a client in Naperville, Illinois, and I explained to them a concept called consumer-driven tax-qualified health insurance. And they thought that was a great idea. In fact, they saw a show with John Stossel on ABC News before he was on Fox Business. And John Stossel interviewed the CEO of Whole Foods. His name is John Mackey. And he went out to John Mackey's stores because his employees were very angry with John Mackey. Because John Mackey decided to cancel the health insurance for his entire company. So they called him all sorts of names. They had their little Occupy Wall Street posters out in front, and they're out protesting. All his employees, oh, he's an evil CEO. All Mackey did is he heard a guy named Senator Bill Archer out of Texas, a Republican senator, who had an idea to approach the insurance industry and try to find a way to lower premiums, some way, somehow. So when he did approach the insurance industry said, we know how to lower premiums. Kill the copay. And he goes, kill the copay, what do you mean? He said, if it's a $10 copay for every medical service that you want, you're going to not only use the plan far more than you should, it's only 10 bucks, sniffles, sneezes, we're going to the ER, we're going to the doctor, but you also have no correlation between the actual cost of health care, right, and what it actually costs you, because it only costs you $10. So let's take the $10 copay out of the way, right? Let's associate the policyholder with the real cost of health care. Make them part of the cost sharing, okay? Let's also get rid of individual deductibles. So you have a family of 3. They all have to have a deductible to worry about at the end of the hospital. Let's kill that as well. Let's give them one deductible for the whole family. After that deductible is satisfied, that whole family has 100% coverage, all the way up to $8 million per person. This is what we're going to call an HSA qualified plan, right? What happened? The premium for that family I met with in Naperville and families around the country dropped by an average of $200 a month. A big savings. So they loved that idea. Now, when Senator Archer ran the numbers with the insurance industry and it was that much of a drop, he said, why don't you give the policyholder an impetus to save that money? Give them someplace to put that money so that it grows tax deferred, so that it grows triple compounding, that it grows interest. If they don't use the money, let them roll it over and use it for retirement if they never get sick. So was devised the world's first medical IRA. Today we call them HSAs, Health Savings Accounts. So I sat with this family in Naperville. They love the idea, right? And they decided to put their money away every year. All that money they was paying for that low copay plan. Fast forward 11 years, they're sitting at over $50,000 in tax-deferred monies in their health savings account. All money that would have went to that insurance company if they hadn't made that decision. Now, let me tell you what happened to Mackey before I tell you what happens here. So they hated Mackey, the CEO. Boys couldn't stand him. So now John Stossel is now on Fox Business, has his own show, separated from ABC. John Stossel decides to have all of Mackey's employees into the audience and then have John Mackey interviewed up on the stage, right? And the first thing he does is play the video from when he used to be on ABC News of all the same knucklehead employees calling him evil, protesting him, blah, blah, blah. And then, after they're watching this, he asked the people in the audience, his employees, what do you think of your CEO today? And they stood up and said, I love my CEO. Why do you love your CEO now? And you hated him then. They said, because I have $8,249 in my HSA account. I have $12,249 in my HSA account. You see, when Mackey saved the money by canceling his health insurance and switching to an HSA qualified plan, instead of pocketing it, right, he put that money every month into all of his employees' accounts. So if you're wrapping fish for $9 an hour, you're sitting on $10,000 in an HSA account. Not your money, the money Mackie was paying to the insurance company before he switched to that. So now they love him. But it also changed the attitude of his employees. So now his employees, when they need medical care, what do? They call the doctor's office and they say, I have to come in for a CBC, a urinalysis, I need a breast exam, I need a prostate exam. What do you charge? And the receptionist goes, well, you have insurance? Yes, I have insurance. What do you charge? Why do you care? You have insurance. Because I want to know what it costs. Well, we have no idea, thank you. So hang up the phone. So they call the next place. What do you charge for a CBC physical? We have no idea. And they keep calling until they find somebody who can give them a price list, right? Why are they doing that? Why are they shopping? Because whatever they don't spend in their HSA account is theirs to keep. Now the consumer is correlated with the cost of health care. And devising those options on a state level for bankrupt Medicaid systems like Governor Daniels did in Indiana have turned red states to black states. And I don't mean politically, I'm talking in the black financially. Meanwhile, our Medicaid system is drowning, and I'll get to that in a minute in Illinois. Now, back to my client who did the same thing, right? 11 years forward, $50,000 in the HSA account. She made a decision to have $5,000 deductible for the whole family, 100% coverage afterward, right? She's stricken with infiltrating ductal carcinoma, which is the worst kind of breast cancer a woman can be stricken with. So now she has to go in for medical dosimetry. She has to go in for MRIs, CTs, all sorts of medical care. But because she sat with me 11 years ago, because she was an informed consumer, she bought an HSA qualified plan with a $5,000 deductible for the family, 100% afterward. So she knew she could what? Control costs. She knew. Then, buried care taxes. Obamacare. What happens now? She gets the following letter from Guarantee Trust Life Insurance Company, right here in Illinois. One of 20 companies that have folded since Obamacare. The purpose of this letter is to provide you with information regarding your major medical coverage with Guarantee Trust Life Insurance Company. The letter is intended to provide notice of an action Guarantee Trust will be taking that will result in the termination of all major medical plans in your state. Will I be offered a replacement plan? Yes, we're required by law in the terms of your policy to offer you replacement coverage. The replacement plan will be a high deductible major medical plan. A high deductible major medical plan is a type of plan that doesn't begin to pay for covered charges until such charges exceed your new deductible. What did she buy? $5,000 for the whole family, 100% afterward. Exceed your new deductible of $25,000 per person.
Per person?
Per person. This is a traditional plan they were switched to. I get a phone call with a woman in tears who's already going through cancer treatment. Now she's wondering, what happened to my plan? I thought the president said what? If you like your plan, you can keep your plan, and no one will take it away from you, period. The president is a liar. What did I do with her? I had to take her off of her plan in the middle of cancer treatment and put her on our high-risk health insurance pool. What the heck is that? Which brings me to the fourth biggest lie the president told. The fourth biggest lie is we have to pass Obamacare to solve pre-existing conditions, right? Because 45,000 people a year are what? Dying in the streets. Remember that? Yeah. Completely ignoring the 1986 law that says if you're 500 feet within any emergency room, they have to treat you, and it's paid for by the few that relevant. Doesn't matter. They're dying in the streets. Total hyperbolic crap. But the American people bought into it. Some of them did. Not all of us. Right? So, what is a risk pool? I want you to know that Congress created pre-existing conditions. Let me say that again. Congress created pre-existing conditions. The president's done a great job demonizing evil health insurance brokers like me and the evil health insurance company, right? Because they don't want to cover you, right? And the other big lie is what? They can drop your plan, your coverage, when you get sick. Now, before I tell you why that's a lie, just think logically. Just think logically. Who would buy health insurance if they can drop your coverage when you get sick? Why the hell would I buy it if they can drop me when I get sick? That is a lie. It has been alive for years, okay? 86 and 96 HIPAA law state very clearly that the only time an insurance company can cancel your coverage is when you commit insurance fraud. That's the only time. So if you don't lie when you buy your health insurance on an individual plan and you tell the truth, they're never going to drop your coverage. But if they really could, why would you buy it? Does that make any sense? But people don't get past the logical thought process. I'd never pay another health insurance premium in my life if they could drop me when I get sick. What do I have it for? So, pre-existing conditions, how were they created? Let's go back to 1996. In 1996, a piece of legislation called HIPAA was written. HIPAA is an acronym that stands for the Health Insurance Portability and Accountability Act. Privacy isn't even in that act. But what does everybody associate with HIPAA law? Privacy. A far more important clause in HIPAA is portability. And portability states the following. If you have had group health insurance through an employer, and you've maintained that coverage for at least 18 months, you lose that job. You have 63 days to find another employer-sponsored group health insurance plan. If you find one within that 63-day window, and you provide the new employer with a certificate of creditable coverage from your former employer's policy, they must cover all of your pre-existing conditions from day one. Now, how do we know that to be true? Anyone in this room ever had an employer ask you how many medications you're on? How heavy are you? Does your family have a heart history disease? Do you have cancer in your family? Any employer ever ask you that? No. Why? Because it's illegal. And it's been illegal for 17 years under HIPAA portability law. And that law has protected 90% of the American insured. If it didn't exist, then if you waddled into an employer's office and you're too fat, he wouldn't hire you because you would cause his health insurance premiums to go through the roof. He must do so because it's illegal to discriminate against you for pre-existing conditions. Obamacare didn't do that. HIPAA portability law did that 17 years ago. So Steve, where did pre-existing conditions come from if people are protected by HIPAA portability law? As usual, when our omnipotent rulers in DC write legislation, they often do it wrong, right? Because many of them have never served in the private sector, like our president, right? So they write things that are incorrectly written. What they did in '96 is they extended total rock-solid portability protection against pre-existing conditions for group policy holders only. That's it. Who they excluded against protections against pre-existing conditions are individual policy holders. Who are these people? These are mom and pops, entrepreneurs, that don't have 5,000 employees at Motorola to negotiate rates with an insurance company. They're just self-employed entrepreneurs. They should have more protection against pre-existing conditions, not less or none. But because they extended no protection against portability for pre-existing for individual policyholders, today and for many years, you can be denied coverage for health insurance on an individual plan if you're too heavy, if you're on too many medications, if you have a family history of heart disease, you can be denied. So let me see. How do we solve pre-existing conditions? How do we do it? And yes, if you spoke to me. I heard you. Yes, there are several reasons. How do we solve pre-existing conditions? Do we need 2,400 pages? No. All you have to do is add one sentence to existing HIPAA portability law. And that sentence says all individual plans are now protected against pre-existing conditions under existing HIPAA portability law. Does that take 2,400 pages? Does it take one page? No. It takes one sentence. And we've killed pre-existing conditions in this nation for the rest of our time. It doesn't exist anymore. Now, what the heck is a high-risk health insurance pool? Remember, that's where I had to put her when her coverage was terminated, thanks to Obamacare, right? Our high-risk health insurance pool is the state's solution to pre-existing conditions. The states developed them 17 years ago when the government dropped the ball and extended no portability protection to individual policyholders. So the states exercise their sovereign rights under our 10th Amendment to do things they want to do, to experiment. And they started high-risk health insurance pools. Here's how they work. And these existed In 35 states, if you saw the debate with Joe last night, you'll hear him repeat this. High-risk health insurance pools existed on a state basis in 35 states before Obamacare was ever passed. For 17 years before Obamacare was ever passed. Now, what is it? Illinois says to every health insurance company that comes in to sell health insurance to Illinois residents that you must give a percentage of your profits to a risk pool. And that pool is for people with pre-existing conditions. And you must issue them coverage into this risk pool with no questions asked. If you have cancer, if you smoke too much, if you have too many medications, if you're too heavy, if you just had surgery, if you're pregnant, it's irrelevant. The risk pool must take you on an individual basis. That's why the insurance companies are commissioned to give a percentage of their profits to these risk pools. And in Illinois, you carry a Blue Cross Blue Shield with Illinois card. So you have the same access to Blue Cross hospitals, the same access to Blue Cross doctors, and Blue Cross processes your claims. The only difference is that the ultimate payor of your claim is the state of Illinois iChip program, not Blue Cross. Now, it's more expensive to get on these plans because you are sick, right? And we could have solved that problem by giving these risk pools a little bit of help. See, every year they get an itty-bitty 2% grant from the federal government. So the premiums keep rising for the sick people, and the government's not helping, right? So what I've been asking the government to do on a federal level is give us more, block grant us more money, like Paul Ryan wants to do with Medicaid, so that these risk pools are more affordable for people who are sick. The president could have done that. You know what he did instead? You know what he did? Our narcissist in chief had to open his own risk pool. He had to call it a pre-existing condition plan, a federal risk pool. And instead of giving the $5 billion that our state risk pools desperately need because those people are paying higher premiums than normal, instead of taking that $5 billion and put it in our state risk pools to help those people, he just put a new federal pool right in your state, right next to your state risk pool, called the new pre-existing condition plan. Right? Now, let me tell you how stupid that was. Plato said, what, how many centuries ago? The penalty for not being involved in politics is that you will be governed by your inferiors. Let me just tell you what I mean by that regarding this issue. Instead of giving money to the risk pools to lower the premiums, he put this in every state, whether you want it or not. Here's what he did. If you're on the state risk pool and you're paying higher premiums and you're sick, you can't get on the new federal risk pool named after Barack Obama, which has much lower premiums because he put $5 billion into it, because you have to be uninsured for 6 months to get on Obama's pre-existing condition plan. If you're on the state risk pool and you've got cancer, are you going to go uninsured for 6 months to get the cheaper premiums in the federal risk pool? No. So they gave them no help whatsoever, which is why very few people enrolled. They said when they rolled out the pre-existing condition plan that hundreds of thousands of people would enroll in it. It didn't happen. Why? Because they got to be uninsured for 6 months to get out of the plan. That is ridiculous. Can I tell you how many clients I've sent to the risk pools over 17 years? In 17 years, I have never not been able to offer somebody health insurance coverage. I don't care how sick they were. Never in 17 years. So when the Obamacare legislation passed, those risk pool clients were calling me saying, hey, are we going to get any help to lower these premiums? Is there anything for us? No. But if you'd like to cancel your state-run risk pool coverage and go uninsured for 6 months, there's a plan for you. Stupid, incompetent, lack of leadership. Now, remember when George Snuffleupagus sat with President Obama on ABC News? And Snuffleupagus was kind of holding him to task by committing a random act of journalism. And he said to the president, Mr. President, I've got the dictionary right here. And the dictionary says that what you're doing with this fine for not purchasing health insurance, it's actually a tax, because this is what it says a tax is. Remember that? What did the president say? I reject that definition. Only Barack Obama can reject the definition of something in the dictionary. And why did he have to reject the definition of something in the dictionary? Because his ambulance chaser attorneys, he knew in a few months, would have to argue in oral arguments in front of the U.S. Supreme Court that it is a tax, right? So what happened? All of us were waiting for the U.S. Supreme Court to help us. right? That was our safety net. What happened? John Roberts betrayed the American people.
How did he do that?
Well, I'm going to tell you.
Yeah, I'd like to know.
We had 4 conservative votes. We had 4 left-wing loon votes, right? When I say left-wing loon, let me just tell you. One of the president's appointees is Elena Kagan, or I call her Mall Cop. Elena Kagan, she looks just like Kevin James, the actor. Elena Kagan actually said in open oral arguments that why would the states be upset with this president's health care law when they're getting a bucket of free money from the government? Where does the money come from, Elena, that you're giving back to us, you mental midget? It's coming from the taxpayers. She literally said, why are the states upset? They're getting a bucket, this is a quote, I'm not exaggerating, a bucket of free money from the government. This is a sitting Supreme Court justice. So when I say left-wing loon, that's what I mean. 4 left-wing loons, 4 conservatives. Here were the votes. One person had to break that vote. Do you know who it was? Chief Justice John Roberts. Kennedy, who we were so worried about, argued with him for 30 days. What are you doing? What are you doing? You can't do this. You can't create a new tax all by yourself, which is what Roberts did. And he didn't even name it. You will not find it anywhere in Article 1, Section 8, under our enumerated powers in the Constitution. You're not going to find it. He didn't even name the tax. It's not an excise tax. It's not a capital gains tax. It's not an income tax. It's what I call, because I named it myself, the Roberts tax. And the Roberts tax is the tax for doing nothing. Nothing. Let me show you how it works. You walk into a 7-Eleven, and the clerk tells you, would you like a pack of gum? And you say, no, thank you, clerk. And then he, under the penalty of law, collects from you the Roberts tax for not buying gum. It's a tax for doing nothing. I've never seen anything like it in my life. And here's how it's going to affect everybody. Do you remember right before the legislation passed, we had a reporter who committed another, what? Random act of journalism. And they asked Edith the Dingbat Pelosi, which is what I call her, because she reminds me of Edith the Dingbat from Archie Bunker. We have to pass the bill fighting with this judge. And they asked Edith, is it true, Edith the Dingbat Pelosi, that you're going to put us in jail if we don't buy health insurance? Is that true? Who remembers that they were going to put us in jail, right? The Tea Party rose up and said, not in a free country. No way. We applied so much pressure that they pulled it out of the legislation 3 months before it was passed. So now the criminal fines were removed. They cannot put you in jail. See, all they were going to do is take the IRS code that says if you don't pay taxes, right, fines will accrue. After 5 years, you become Wesley Snipes. And you're going to go to jail. They just took that out of the IRS, plopped it in Obamacare. We caught them while they were plopping, right? We stopped them. Which presented a unique problem to our statist-in-chief, Barack Obama. You see, now he can't threaten you with any criminal fines. So if you do not comply with the new mandate to purchase health insurance, he can no longer put you in jail. So USA Today put on a little article, and here's what they said after that happened. The IRS lacks clout to enforce mandatory health insurance. Starting in 2014, all Americans will have health insurance, will be forced by the IRS to purchase health insurance. Under the law, Americans who cannot afford health insurance but refuse to buy it will pay a fine of up to $695 or 2.5% of their income. While the IRS can impose liens or levies, seize property, or even seek jail time against people who don't pay their taxes, it is specifically barred now from taking such actions against taxpayers who ignore the insurance mandate. Right? So let's say you don't want to comply. So Barack Obama said, I got to fix this. What am I going to do? I'm tyrannical in nature, so let's see if I can figure out what else I can do. I know what I'll do. Here's what I'll do. I'm going to commission the Internal Revenue Service. And they're going to come after you if you don't buy health insurance. Which is why we just recently hired 4,000 new IRS agents just to collect a 10% fine on tanning salons. That's it. That costs us $11 million. We have about 16,000 more coming, right? Here's how it's going to work. In 2014, who knows what the fine is in 2014 if you refuse to comply?
900, I think.
2,000.
$95. That's an annual fine. $95, right? It graduates to $695 by 2016, right? So let's say you're living in mom's basement, right? What's the failure to launch clause? How long can you stay on mom and dad's policy? 26. The failure to launch clause. At 27 now, you have to now buy your own health insurance. You're actually an adult, right? So now you have to buy your own plan, right? So you decide that you don't want to spend that. You want to spend more money on your new iPhone upgrade, right? How many people, because remember what the IRS was commissioned to do, what? You don't do it, we're going to hold what from you? We're going to hold your tax refund, right? How many people on a percentage basis in this nation actually pay income taxes and get a refund? 53%. 47% pay no income taxes. How do you hold a refund from someone who pays no income taxes? So who's really going to be paying for all of this? Raise your hand if you're one of the few, the proud, the 53%. Right? Now, let's get to what was passed besides the mandate, thanks to John Roberts, who created the Roberts tax, all by himself. Right? What other things passed were the community rating clause. The community rating clause and the guaranteed issue individual mandate. What's that? Okay. Let me just give you an idea. Under Obamacare, you can wait until you find a lump and then go buy a health insurance plan. And every health insurance company has to issue you coverage, guaranteed issue. When you resolve the lump issue and you no longer need treatment, you can dump the plan because you can get another plan anytime you want because they always have to give it to you guaranteed issue. So how would that work? Let's equate it to car insurance. Let's equate it to homeowners insurance. Let's say you waited until your house burned down and then you call State Farm and ask them to give you a policy to rebuild your pile of ashes. It's actuarially impossible, right? But it's exactly what we're doing. If we let that go forward, we will bankrupt the rest of the insurance companies, and the big ones will be the only survivors, and they will become heavily subsidized, taxpayer-funded utilities. That's it. Now, besides the guaranteed issue individual mandate, what else? Community rating. Now, I have to make room here. I need to, where's my water? So I have to behave like a liberal now, which means I have to sever my skull and just operate with this. I want you all to sever your brains from your heart and just operate with this, because liberals are ruled, enslaved, and governed by emotions. So you're just all heart now, okay? And you come into a state and you win in that state, and now you make the rules in that state, as liberals have done in 12 states and implemented community rating. Okay? Now, you walk into the state, you're a new legislator, you've got enough liberals to pass it, and you look around and you go, you know, we're about equality and fairness. I've looked. There are people in this state who are actually paying less money for their health insurance than other people. Other people are paying more for their health insurance. That's not fair. That's not fair. We have to make sure everybody pays the same health insurance, because that's fair and equitable. Everybody's got to pay the same premium, right? Now, if your head is detached from your heart, you're not thinking, that sounds good. I would almost support that, right? God, that sounds smart. Until your head is back attached to your body, you're now thinking, and you realize what it's done in 12 states. You're now a 27-year-old, you're past the failure to launch clause, and now you have to buy your own plan because you're an adult, right? You go out there, because you're young and invincible, your premium's really low because the insurance company knows you're young and invincible, you won't have claims for many years. So you're going to pay about 60, 70 bucks depending on the plan. You're going to get a nice policy. And it's going to stay low for you for many years because you're young and invincible, actuarially and statistically. Liberals come to town, they want to level it all off, right? Everybody's got to pay the same premium. So what happens? Well, now Mr. 27-year-old has to subsidize Mrs. 62-year-old, whose premiums are about $460 a month. So as soon as that happens, what happens to Mr. 27-year-old's premium? Right? The definition of a split second is the time it takes that 27-year-old to call the insurance company and cancel his coverage. Right? It only takes him a few more seconds to call all his Occupy Wall Street anarchist protesters and tell them to cancel their coverage too, because they're all now subsidizing Mrs. 62-year-old. So what happens to the risk pool when all the young invincibles are gone? Smaller, smaller, smaller. Now we got a really small pool. Who's left in that pool? Mrs. 62-year-old. You know what happens to her premium? Is this rocket science? No. The penalty for not being involved in politics is that you will be ruled by your inferiors. This is not rocket science. It's not like we're trying new things here. This has been done in 12 states, and what it led to was massive uninsured and massively increased premiums. It's very frustrating. Now, two more things. Three more, actually. The lie they're telling now. The next time you hear Debbie was a man Sergeant shows, or you see David Axelrod, or one of the other talking point masters on the left, who say that the Republicans are trying to, quote, end Medicare as we know it. In fact, our friends on the left, again of which I have none, put together a commercial with a nice-looking gentleman who looks just like Paul Ryan's got the widow's peak and everything, and he's got Grandma in a wheelchair, and he's rolling her and then pushes her off the cliff. Democrats, keep it classy. Right? I want you to know that the person who's really pushing that wheelchair looks more like Alfred E. Newman with a nice tan. Because it's Barack Obama who's pushing that wheelchair. No president in U.S. history has ever cut $716 billion from Medicare. It's never happened in U.S. history until Barack Obama.
And he said, give Grandma a pain pill where she is.
Yes. He also said doctors like to cut people's foot off. Diabetics. Thank you, Mr. President. So no president has ever done so. How did he do it? $416 billion of the $716 billion is a reduction in payments to doctors, hospitals, and home health care clinics. $136 billion of it is the destruction of Medicare Advantage. Now, Medicare Advantage is the most popular Medicare supplement plan in the nation. The most popular Medicare plan in the nation. 4 million seniors love it because it includes Part D, which is the prescription drug coverage. It's all wrapped up into the same thing. It's called officially Medicare Part C. Okay? Because they were desperate to raise money for the largest entitlement in U.S. history, which is Obamacare. See, it should upset you this is happening. Because if you're seniors and you paid into this system your whole life, understand that that money that they're taking from Medicare is going to give people subsidized health insurance who never paid a dime into the Medicare system. That in itself is fundamentally unfair. Back to Medicare Advantage. October 2012 was the scheduled decimation of Medicare Advantage under the health care law. The president's advisors told him probably not that good to kill Medicare Advantage 1 month before the elections. So Mr. I love executive orders himself, Barack Obama, decided to write another one. Shift $8 billion from an Obamacare research fund and forego the death of Medicare Advantage until after the 2013 elections. How many knew that he actually even did that? That's what he did. That should upset you. Because if Obama gets reelected, you can kiss Medicare Advantage goodbye. Because he thinks doctors get paid too much in the Medicare Advantage program. Now, who's really ending Medicare as we know it? The Democrats, correct. They've already done so. Okay? Who has heard of Richard Foster? Richard Foster is the chief Medicare actuary. You cannot go higher in the government's Medicare program than Mr. Richard Foster. And every year, he has to write an annual report of Medicare. And then he has to give his assessment in the last few pages of the annual report. He did his own assessment on Obamacare. And in his assessment, he states that over the first 10 years, Obamacare will cut 1.08 trillion from Medicare. And over 20 years, it will cut a total of 4.95 trillion. In other words, the end of Medicare, as we know it, has already been put in place by Obamacare. But it's far worse than that. Because according to Foster's assessment, the amount of reimbursement ratio the government pays to doctors who take Medicare will be lowered to less than what it pays doctors who take Medicaid. If you're a doctor in Illinois, you have not been paid by Medicaid for nearly 2 years. And when you are paid, it's an insult what they pay you. And Medicare is already very low reimbursement ratios to doctors. How do I know that? Before Obamacare passed in 2009, the Mayo Clinic said, we're done. Arizona, the entire Mayo Clinic in Arizona said, we're not taking Medicare anymore. And many more have joined them since. Now, if we're going to reduce the amount of reimbursement ratio that the government pays to doctors who take Medicare to less than it pays to Medicaid, and according to the latest assessment from the Congressional Budget Office, we're going to be adding a minimum of 17 million more people onto Medicaid. Is that not a death panel? You don't have to use a death panel. You just have to get your calculator and figure 17 million more people, and we're not adding doctors, and the law specifically prohibits doctors from opening their own hospitals. Are we going to be waiting for care? Yes, we're going to be waiting for care. You cannot flood our current healthcare system with 17 more billion people in January 2014 and expect it to function the same way. It's just simple numbers. It's just simple numbers. Why is it frightening that we're expanding Medicare to Medicaid to 17 million people? Because Medicaid is the worst healthcare system ever devised by humankind. Medicaid kills. What do I mean by that? The American Academy of Cardiology in 2005 did a lengthy study to determine how the survival rate is for people who have surgery on Medicaid compared to those who have surgery on private health insurance. The shocking results is that you are 50% more likely to die on Medicaid than you are when you have private health insurance. So as soon as that study came out from a respected organization like the American Academy of Cardiology, government said, we can't have that. That's our Medicaid program. 50% more likely to die. We got to put more big government on that, and more big government will fix it like it fixes everything, right? Fast forward 4 years to 2009. And in 2009, the University of Virginia does a follow-up study to that more big government to fix the problem. 2009, you're now 97% more likely to die after surgery on Medicaid than you are with private health insurance. And this study was 2009. Great for emphasis. 2009. Right? Before we put a minimum of 17 million more people onto our Medicaid system. Is that not a death panel? I mean, how many more numbers do I have to work for you before I realize, my God, we're in big trouble? Which is why we have to repeal the legislation. It must be repealed. Now, is Paul Ryan really pushing that over the cliff? Now, Paul Ryan is saving Medicare. The next time you hear Debbie Wasserman and Sergeant Schultz, or you hear any of those left-wing loons repeat their White House talking points, that there are vouchers in Paul Ryan's plan. Anyone who uses the term voucher is a liar. Voucher was under the Ryan-Rivlin plan. The Ryan-Rivlin plan, Paul Ryan Alice Rivlin, was demolished in December 2011. It no longer exists. And when it was demolished, vouchers were demolished. It was replaced by the Ron Wyden, far-left liberal senator from Oregon, and Paul Ryan plan. It is a bipartisan plan. And in that plan, they actually cut over $500 billion from Medicare. Paul Ryan cuts $500 billion from Medicare. President Obama's cut $716 billion. The difference is how the cuts are made. Barack Obama simply cuts reimbursement ratios to doctors who are already paid very little under Medicare, right? Paul Ryan introduces for the first time in U.S. history competition into the Medicare arena. Now, if you have a friend on the left, I have none, but let's say you do, and you have a conversation with them, and they say, I hate Paul Ryan because he's going to end Medicare as we know it, his plan is going to destroy Medicare, blah, 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 Barack Obama's going to say it. I want you to know that both Obamacare and Paul Ryan's Medicare reform plan both function the same way. Both of them provide government-subsidized health insurance inside government-run exchanges. The difference is that Obamacare provides subsidies for health insurance for people under 65, and Paul Ryan's plan offers government subsidies for health insurance for people over 65. And it affects no one the age 55 or older today. It's just those younger when they get to 65. Why is that cutoff at 55? Why? Because according to the chief Medicare actuary and the CMS, Medicare will be dead, bankrupt, kaput by 2016 or 2023. 2016 is 4 years from today. The only reason Medicare lasts till 2023 under Barack Obama's plan is because he cut $716 billion from Medicare. That's the only reason. So what Paul Ryan's plan does is it introduces competition from the private health insurance arena into the Medicare arena. Not giving you a voucher. It will guarantee to seniors the 2 lowest price plans in the new Paul Ryan Medicare health insurance exchanges. Will you be given the option of traditional Medicare? Yes. You can stay with traditional Medicare, but you'll have the option to purchase Medicare health insurance in a government-run exchange with premium support, just like Barack Obama does for people under the age of 65 in Obamacare. Because both men know what? Medicare is going bankrupt. So because Paul Ryan is a free market person, he introduces competition. Now, you're guaranteed premium support if you're low income for the lowest 2 price plans in those health insurance exchanges. If you want to buy up and buy a plan that pays your Medicare Part A and Part B deductible, you can buy up if you're guaranteed those 2 plans, or you can stay with Medicare. And the reason Paul Ryan and Ron Wyden didn't take traditional Medicare off the table is because it's going to be gone anyway. They don't have to take it away from you. It's going to be bankrupt. Do you follow me? So both Obamacare and Paul Ryan's Medicare reform plan do the same thing, introduce competition. The problem with Paul Ryan or Obamacare's plan is that it has the taxpayer subsidizing people far above the federal poverty level. You see, Barack Obama has done what Blago did in Illinois. He took Blago Care and spread it everywhere. We have 50 beautiful laboratories in this nation, or if you're Barack Obama, 57. And in these states, you can experiment and do things, okay? Here's what Blago did in Illinois. Blago got money from SCHIP, as every other state did. What is SCHIP? The federal SCHIP bill was passed under President Bush, passed on a bipartisan basis, and it says, and both parties agree, that children of the truly indigent, the truly poor, should have taxpayer-funded free health insurance. All poor children. We all agree. We passed SCHIP under Bush. States got billions of dollars. Under President Obama, $36 billion more in 2009. Well, Blago, as Democrats and Rhino Republicans often do, when they get money, they like to spend it, right? And they often spend it to pander for more votes. Okay, so we had in Illinois something called Kid Care. And Kid Care was to help poor children. Blago changed it to all kids covered. Okay, but remember, he's getting all this money from the federal government under SCHIP. So he thought to himself, well, what if I give health insurance to Mom too? Would I get more votes if I give her free health insurance? I think so. So I'm going to create a new program called Moms and Babies. And Moms and Babies says that if you're 8 months pregnant and it's your 7th child, it doesn't make a difference. Right before it pops, you can line up, boom, and the state payer pays for it. And they pay for the kid too, right? So Blago said, boy, I'm getting a lot of votes and support because these women are getting free health insurance paid for by the few, the proud, the 53%. Let's give Daddy health insurance too. And let's have only one thing to prove that he lives with her, just a utility bill. That's all he needs. The so he lives with the mother of the child, Daddy gets free health insurance too. And let's not offer it to just the poor. Let's take the eligibility level 138% above the federal poverty level. So he can get on it and you're not poor now, right? But here's the worst part. You see, Blago knew that Chicago is a sanctuary city where illegals can come here and march with their Che Guevara hats and shirts, say how bad America is, and ICE can't deport them. So they're already a big magnet in Illinois, in Chicago, because you can't be deported. So he said, I'm just going to offer them free health insurance on the state taxpayer too. So the Chicago Tribune decided to do another random act of journalism and decided to figure out how many people illegal are on our Medicaid system. I wonder how many. Who would like to guess a percentage?
65%.
75%. Today, under Patty O'Quinn, our current status governor, there are still 77,000 illegal aliens on our Illinois Medicaid system. And there are no plans, not even a discussion, to remove them.
And that coverage carries if they leave the state.
Oh yeah,
We
yeah.
still pay for it.
Not anymore though. The new Medicaid reform bill that was passed by 15 rhinos and the Democrats, they passed a Medicaid reform bill and they put a TPA in place. Thank God. Every other state that runs a Medicaid program has had a TPA for years, a third-party administrator. And the TPA does just this one thing. They send you a form every year and they say, are you still alive? Because if you're dead, we don't want to be paying for you. Okay? Number two, has your income increased? Because if you're rich, we don't want to be paying for you. Okay? And it's supposed to, as other states do, ask a very important third question. Are you still living in Illinois? Right? So our Medicaid reform bill put that TPA in. Third-party administration. So now they're going to get a letter that says, are you dead? Are you rich? Are you still living in Medicaid? Or still living in Illinois? The reason that they put that in is because we had a recent testimony from a pharmacist down in Kentucky who said some of our best customers in Kentucky are Illinois Medicaid recipients. You see? But unfortunately, there's still no question in the new forms that say, are you an American citizen? So now we have children of American citizens who are truly indigent, who cannot get access to care, whose prescriptions are now being denied since this new Medicaid reform plan, because 77,000 illegals are in front of them. And we're taking that same thing with Obamacare, what Blago did, and we're increasing the federal poverty level to qualify for health insurance, just like Blago, 138% above the federal poverty level for an individual, and 400% for a family of four. That means a family of four under Obamacare making $89,000 a year can get federally subsidized health insurance in the new Obamacare exchanges. And if you think people lost their health insurance now, wait until the fine for employers with 50 or more employees goes into place. Because now it's $2,000 if one of your employees who you're insuring now, if you charge them more than 2.5% of their annual income to share the costs of health insurance, you charge them a penny more, bingo! They now qualify for health insurance in the Obamacare exchanges, and you, the employer, have to pay $2,000. I sat with an employer just a couple weeks ago. You know what he told me? If we don't repeal Obamacare, I can't wait for 2014. Why would he do that? Because he can't wait to kick everybody off his plan. Because he's paying a hell of a lot more than $2,000 a year for his employees. He's going to save a fortune. And even the employers who say, I want to keep you on your plan because I don't trust the government-run exchanges, I want to be right by your employer, they're going to have to do it to stay competitive. Because if this business owner is cutting his margin down by health insurance by 80% by paying $2,000 instead of $15,000 per employee, you better do it to stay competitive or you're going to go out of business. So if you think we lost health insurance coverage already, we're going to lose a lot more. And what did the president say? If you like your plan, you can keep your plan. And no one will take it away from you. Period. The president is a liar. Two things, and I'll be done. Why is health insurance so expensive? The president likes to tell us because it's the evil insurance companies, right? Who like to drop your coverage when you get sick. Who remembers a joint session of Congress where President Obama was talking to Democrats and Republicans, and he said a man from Downers Grove, Illinois, had his health insurance coverage canceled, his treatment delayed, and he died because of it? Who remembers that exact quote? The Sun-Times now. The Sun-Times decided to commit another random act of journalism. And they wanted to see if that thing that President Obama said during the joint session of Congress about Otto Raddatz was actually true. So they found out who the guy was, Otto Raddatz. Here's what Otto Raddatz did. He bought an individual health insurance plan, and he not tell the truth on his individual plan. When you don't tell the truth to an insurance company, what is that called?
Fraud.
Fraud, right? The only time they can rescind your coverage or cancel your coverage when you're sick is when you commit fraud, right? So the insurance company, Assurant Health in Milwaukee, Wisconsin, this is a true story, thanks to the Sun-Times, who went and investigated. They sent a letter to Mr. Ravitz and said, hey, we went in your medical records because you're filing cancer claims like right after you bought the plan. And we see you had a condition we didn't know about, and if we knew about the condition, we would have never gave you health insurance in the first place. So we're considering returning you back to where we found you, which is what rescission is. Hi, we found you uninsured. We're going to return you to where we found you, uninsured, meaning we're going to give you all the money you gave us in premiums too, back. That's rescission, right? Honorad's sister called the Department of Insurance in Illinois. They called the Attorney General's office in Illinois, and they called Assurant Health Insurance Company in Milwaukee, Wisconsin, and they asked them one question. We know it's under your legal rights to cancel his coverage. Please don't do it. He needs a $200,000 bone marrow transplant to save his life. Ready for the real story? They never canceled his coverage. They paid his claims for 4 more years, and then he died. That's a true story. Barack Obama is a liar. And he's lying to us again today. He has Tom Hanks putting together a DVD, which really breaks my heart, because I loved him. The Wilson, I love all of them. Castaway, I love the guy. He's an Obama drone. He's putting together a DVD called The Road We've Traveled, off a clip. I edited that. And in The Road We Traveled, he tells the story about Barack Obama's mother. The president is the kind of man who would lie about his own mother. And the lie about his mother's health insurance plan, where she had pre-existing conditions that weren't covered, it's a lie. It was proven lie in 2008. She had a disability plan, not a health insurance plan. And every time I tell this story, there's usually one liberal in the audience, and they go, the president's very busy, he has a lot of things, foreign policy and economy, maybe he just didn't know this, maybe he's just too busy. And my response is always the same. Do you know who the attorney was that represented Barack Obama's mother in her disability claim? It was an attorney with big ears and a penchant for lying, Barack Obama. So there's no way he doesn't know. He's lying to you again. Last, health insurance. Why is it so expensive? In 1979, there were a total of 279 mandates placed on health insurers in this country. Total, nationwide. Stating that if you come in this state, you want to sell health insurance, you better cover cancer. Okay, we'll cover cancer. You better cover this, you better cover that. All medically necessary expenses. Who would like to guess how many mandates are on health insurance policies post-Obamacare today? 2,318. Right? That sounds like a big number. I brought them all with me. Here we go. Ready? There they all are. This is why health insurance is so expensive. It's all of the federal mandates. Now you would think, have there been 2,300 new conditions that have developed since 1979 that are medically necessary? Oh no. No. Let me just go over a few of them. Ready? Hair plugs. Really? Hair plugs. Why is a taxpayer paying for hair plugs? And if we paid for vitamins, we got ripped off. Health club memberships, massage therapy, infertility. Why am I paying for infertility? I don't even have the plumbing below my navel to have a child. I got to pay more for infertility? All of these things, many of them, are not medically necessary. I mentioned paraprosthesis already. So it's the government's intervention into the health insurance arena that costs us more money. Okay? Then we have the McCarran-Ferguson Act of 1945, which has to be repealed. It states that you can't sell health insurance across state lines. And then we have liberal legislators in states like the land of fruit and nuts, California. And in California, all 4 UC colleges, including UC Berkeley, guess what's a mandated covered expense on their health insurance plan? Coverage to turn your outie into an innie, and I don't mean your belly button. Oh yes, sexual reassignment surgery. When liberals come into states and put that stuff on health insurance policies, you know what the health insurers do? Bye. We've got 49 other states to do business in, or 56 if you're Barack Obama. And they go to the other states where you're not so crazy. It is the intervention of the federal government that drives up health insurance premiums. It is the intervention of the federal government that created pre-existing conditions. Last but not least, and here's where I'll close. Let's say you're no longer working. You're retired. You're living on a small pension. You're living on a retirement portfolio. You've invested wisely, conservatively, I hope, right? Do you remember when Nostradamus, which is what I call Henry Waxman, when Nostradamus commissioned John Deere and Caterpillar to come into D.C.? Because John Deere and Caterpillar corporations were saying, this law is going to kill us. We run the numbers. It's going to cost us millions of dollars. Please stop it. So Nostradamus said, well, you prove it. I'm holding a congressional hearing right here in D.C. I'm going to have the press here. And you show me your numbers. So all John Deere and Caterpillar said was, hi, CPA actuaries, send the numbers over by email. So they sent them over by email. You know, there was never a congressional hearing with Henry Waxman. You know why? Because John Deere and Caterpillar, they were right. So as soon as that hearing was canceled, Lloyd's of London, one of the most respected actuarial firms in the world, decided to go out and interview a few other companies. Maybe it's just not John Deere and Caterpillar. Maybe everybody's getting hurt with this. So they put together a list of 80 companies. 80 companies. Now, while I'm going over the names of these companies, I want you to just think, is it possible I could have one of these companies in my retirement portfolio, right? According to Lloyd's of London, starting in 2013, companies that provide prescription drug benefits for retirees under Medicare can no longer deduct this subsidy from their taxes due to the federal health care overhaul signed into law on March 23, 2010. Here's companies. I'm not going to read all 80, just a few. Ones you know. Walgreens. Walgreens is going to take a $44 million loss starting January 1st, 2013. Walgreens. Pfizer, a $270 million loss through Pfizer. Got any Pfizer stock? Don't tell me, just think about it. Granger, $11 million. Norfolk Southern, $27 million. Ecolab, $5 million. Caterpillar, $90 million. Pepsi, $40 million. Boeing, $150 million. MetLife, $75 million. PPG Glass, $85 million. United States Steel, $27 million. Verizon Communications, $970 million. Ingersoll Rand, $41 million. Lockheed Martin, $96 million. John Deere, $129.5 million. AK Steel, $31 million. Honeywell, $13 million. Exelon, $65 million. And the granddaddy of them all, AT&T, $1 billion. Do you think it's possible, just possible, that they might raise the prices for the products that they offer? Do you think it's possible they might lay some people off? Already adding to the almost 16% historic unemployment. You see, Barack Obama also lies on unemployment numbers. We haven't had 8% unemployment in this country for years. Barack Obama conveniently does not include the U6 numbers, or mean unemployment, people who have given up. Put them back in, you're looking at 16% unemployment. Think we'll add to it with this? Here's how I know we will. Because the numbers I just read to you are first quarter losses only. Now multiply them by 4. What can we do? What can we do to stop the legislation? We've been betrayed by the Supreme Court. There's only one thing left to do, and that is we now have to stop it. It's now up to us. You must support SenateConservatives.com. We must get control of the Senate. We do not need 60 votes. We need just 50 plus 1, and we will use the same bill they used to shove it down our throats on a purely partisan basis without one Republican vote at 2 in the morning on Christmas Eve 2009. They used the reconciliation bill. We're going to do the same thing with 50 plus 1 votes. But if you can walk for these candidates, if you can call for these candidates, if you can donate to these candidates, they're vetted by people like Jim DeMint and Mark Levin. They're solid. We have to take control of the Senate. And then we cannot get rid of Obamacare without repealing the worst part, the Obama. Thank you for listening. Yes, sir.
Could I ask one question?
Yes, go ahead.
Or could you tell us, the first time I saw you was in October of 2010.
Yep.
And you told us about a story of 2 farmers One lived in the United States, one lived in the Canadian border,
Yeah.
across the Canadian.
Yeah.
Both of them very close, broke their arm, and the Canadian had free health care. Could you tell us about that?
Yes, people, our friends on the left, which I've done. Thank you. They love to use Canada as, you know, as the reason why everything's so great. We should have universal health care, socialized medicine. When you get time, go to freemarketcure.com. freemarketcure.com. There's a documentary filmmaker named Stuart Browning, and he took his cameras up into Canada and decided to find out what the real Canadian healthcare system is like. There are 4 videos. One of it is called The American Uninsured, which will run through the numbers I gave you from the U.S. Census Bureau. The other is called The Lemon. The other is called 2 Women, and then the other is called A Short Course in Brain Surgery. There is a man that opened a shop on the border between Canada and the United States, and all Rick Baker does at Timely Medical is arrange for Canadian citizens to come to the United States to get their health care. Because they have to wait to get an MRI for 3 months, 4 months, 5 months, 6 months. They have to wait for surgery. There are long waiting lists for special care, right? So Rick Baker just brings them over to the U.S. and they have it done. You will see heartbreaking stories of people who were denied medical care in Canada and they could not get it, and thanks to Rick Baker, their lives were saved. One of them was a man who had a brain tumor who was told he had to wait 6 months for an MRI. They called Rick Baker's office. Rick Baker got him into Ohio Cleveland Clinic, had the MRI done the next day, and his tumor in his brain was removed. It was, if he had weight 362, he would be dead today. And the doctors explain this to you in the film, after one story after the other story. But because Canada does not regulate pet care for your pet, you can open any Canadian phone book and you will find next day MRI and CT for your pet all the way through the phone book because there's competition. But if you're a human, no. But your hamster should.
Is this what we have to look forward to?
Yes. 100% so, yes.
And when? How soon?
If it's not repealed. It won't take long. It will take probably 3 to 5 years for the rest of the health insurance companies to fold.
Do you think Mitt Romney's going to repeal it?
Good Lord, yes.
You think so?
Absolutely right.
Yeah.
Mitt
My
Romney's,
question is, how can he repeal it if the IRS is collecting the money?
we use a budget bill. We use a budget reconciliation bill. The whole legislation other than IPAB can be repealed. What's IPAB? IPAB is the Independent Payment Advisory Board. You know how Sarah Panel said death panel? Let's not use the word death panel. Let's use the word board. Okay? Thanks to Obamacare, we have right now 15 unelected bureaucrats that the president is going to be appointing later this year and into next year that are commissioned to cut another $500 billion from the American healthcare system. And the decisions they make regarding cuts to Medicare cannot be overturned by an act of Congress without a 2/3 majority vote. So IPAB, for all intents and purposes, has replaced MedPAC. MedPAC was a board in the government that would make a recommendation as to what we should cut from Medicare. A recommendation. That recommendation would go to Congress. Congress would say, whoa, you can't make this much cuts. You can't do that. We're not going to allow you to do it. We're not passing your cuts. The reason they call IPAB the Independent Payment Advisory Board is because it's independent of Congress. And they can make those cuts all by themselves. But if they can't make those cuts and come to a conclusion, it falls to one person to make those cuts. Do you know who that is?
Not Kathleen.
That's Kathleen Supercilious. That's right. Far left-wing nut job, Kathleen Supercilious. She gets to make those decisions. Now, the other thing to be worried about is the people who crafted this legislation. Who has heard of Dr. Donald Berwick? Anybody? Who has heard of Dr. Ezekiel Emanuel? The fleshly brother of our 9.5-fingered mental midget Marxist Bayer, Rombo, tiny dead fish, tiny dancer, twinkle toes, ballerina boy, Emmanuel. It's his brother. And he was one of Barack Obama's chief healthcare czars. And he believes today in a system called the complete life system. Now, I don't have a chalkboard. Is it a chalkboard? No, it's just a wall. Just go with it. This is Dr. Ezekiel Emanuel's system. Over here, you're at the age of 0, okay? It's a bell curve. Up the bell curve, up here is the age 35. Down here is the age 45, where I'm at. Over here is 65, 70, okay? So here's the bell curve. Everybody got it? Down here, Dr. Ezekiel Emanuel, one of Obama's chief healthcare czars, who helped craft this legislation, believes that if you're at the age 0, you should receive very little to no care, because you are a complete and utter burden to society. You're not a good busy worker, you're not a busy bee for the collective, you're just an infant, helpless, reliant upon others. So the amount of health care you should get should be very little. How do we know the president believes in this? Because other than voting present, which is what he mostly did while he was a senator in Illinois, one of the votes he made sure to vote for was to kill the Born Alive Protection Act. Hillary Clinton would not vote to kill the Born Alive Protection Act. Barack Obama did, not once, 4 times. What's the Born Alive Protection Act? It protects a child who survives a botched abortion. This legislation would instruct the nurses to take the baby, put it in a room, and let it cry until it dies. Your president supported that law, not once, but 4 times as a senator in Illinois. So this is why they don't feel you should get much health care at the age of 0. Here comes old Dr. Z. You get up to age 35, all of a sudden up here, you're a good, strong back, good worker for the collective. You should get the most health care you should ever get in your life at age 35. Then you go down the bell curve. I'm right about here. I'm rapidly losing value to Barack Obama. You get down here to 65, 70, and all of a sudden the amount of health care you should receive is very similar to how much you should get over here.
Because you're not cost effective anymore.
You are a burden again.
You're a burden.
You do not believe me, go to the Wall Street Journal, look up the complete life system. Go to my blog, truthaboutobamacare.com. Look at what's behind this legislation, who is behind it. It's terrible. It really is. It's not hyperbole. Other questions? Anyone else? Yes, sir.
Now, I have a few questions, so what I'm going to do is ask one, and then when everybody's done, I'd like to ask the others, because they are relevant. Okay, the HIPAA cost premiums going up for pre-existing conditions. The exact question on break during morning. The exact question I wanted to ask. Okay, it causes premiums to go up because of pre-existing conditions. Now, that law being passed, is that part of the reason why costs have gone up so much since the 90s? Was because of HIPAA?
No, mandates. Mandates in McCarran-Ferguson. We disallowed insurance companies from selling across state lines.
You know, now that's another question. Why did they do that? Why did they make it? What was their alleged reason for not?
You cannot ask an intelligent, informed American to explain something an idiot does. I can't tell you why. I can't tell you. All I know is it has to be repealed.
But are you sure? Because one insurance guy told me that they could sell across state lines, and I always heard they couldn't.
I can sell my products. I can license in Texas, and I'm licensed in 10 states. I love selling health insurance in Texas because they have tort reform. Premiums are lower. Tort reform is lawsuit reform, right? I can sell in Texas all day long. A Texas agent, right, can sell Illinois products in Illinois. An Illinois agent can sell Texas products in Texas. I can't take my Illinois products and sell them in Texas. But if I could, Texas wouldn't want them anyway. Because we piled all the mandates on top of ours, right? Rick Perry said, no, we're not going to do that in our state, right? So the intelligence things that Perry has done can't be spread across to the rest of the states because laws like the McCarran-Ferguson Act prohibit competition, okay? The other are the mandates, piling on unnecessary, medically necessary mandates onto health insurance policy saying you must cover this, does nothing but raise premiums for everybody, right? So those are the reasons health insurance costs more, and like I mentioned, tort reform. We have to have lawsuit. The reason we don't have tort reform in Obamacare, that right-wing, radical, Tea Party Republican, who's the guy right behind me? Who's the Democrat? Howard Dean. That's what I call him, right-wing, radical, Tea Party Republican. It's actually a left-wing loon. He told us, and I quote, the reason we don't have tort reform in Obamacare is because we didn't want to, quote, piss off the trial lawyers. That's a direct quote from Howard Dean. So doctors are running far more tests than they have to run because they're afraid of being sued. So if we had tort reform to limit liability cases, the doctor would not have to be so afraid, number one, his premiums would go down. We have just a handful of OB-GYNs left in Illinois because we have no tort reform in Illinois. So nobody from Texas wants to buy my Illinois plans. They want me to be able to sell them the plans approved in their state. You follow me? So those things would dramatically lower health insurance premiums. Less government in all things lowers prices in the free market. I don't care what you're selling. It's just a fact. What was the premise of your question that you got off on something else?
Well,
HIPAA.
Yeah, HIPAA, because I wanted to know what pre-existing conditions, which I can only imagine would make premiums skyrocket.
Right.
People have complained they would have gone up anyway over the last 15, 20 years.
HIPAA works, and I'll tell you why HIPAA works. When I have somebody who works for an employer, it's a group policy, they call me well before the 63rd day. Well before. Because they're terrified to get to the 64th day. Because they know if they get to the 64th day without coverage, they now must face pre-existing conditions on the group policy. So they work their butt off not to get past 63 days. And once they get a new plan, they make sure they keep paying their premiums, right? Because the law compels them to do so. You don't have to force them unconstitutionally. You just have to do what's been done for 17 years and works very well. You continue to pay in the system so that the insurance companies can build up the necessary billions of dollars in reserves that the states require them to have in reserve capital, not investment capital. That money's got to sit there in a reserve for you to sell health insurance in the state. And it's got to be whatever it is, billions, millions, whatever the state says. If we do these things, we put McCarrick-Ferguson Act in the toilet, we flush it, so they can sell health insurance across state lines. If we implement tort reform, if we reduce the mandated coverage for sexual reassignment surgery in states like California, infertility in Illinois, hair plugs in other states, get rid of these things. Give it as a rider option. You want hair plugs, you're Joe Biden? Then pay for an extra rider. Your plan pays more for you, not me. Very simple to solve the problem with health insurance. But they don't want to solve the problem. They want control over the entire healthcare system.
Yeah.
That's it. Because what do we know already? If they control your health, they control everything. And that's why they want it.
And one thing, just I want to make a note, when you say McCarrick-Ferguson, I assume you're talking about Senator Pat McCarrick from Nevada. That's no relation to me. He's spelled with an A and I'm an O. So just a
He's not
little
associated.
disclaimer here.
Any other questions? Yes, sir.
Go ahead.
I know personally I've already seen the effects of the Obamacare and that. Just this week we got an email about our new health insurance plans and all that. Oh, guess how much mine's increasing from this year to next year?
Probably 30.
A week. I pay bi-weekly my contribution.
Oh, okay.
Somebody take a guess,
$100.
percentage-wise.
Oh, I'd probably say 15–20%.
140% increase. I went from paying bi-weekly $110, I'll be paying $250 bi-weekly to keep insurance.
Do you know why that's happening? Medical loss ratios and the new wave of mandates. The medical loss ratio stated on 9/23/2010. That's when they cut every health insurance commission in half. Every broker in this country who sells individual plans, our commission is cut in half on 9/23/2010. Worse than that, they told insurance companies if you underwrite more than 50 people, you must reduce your operating margin, not your profit margin. Your total operating margin down from 25 to 30% where it is sat historically, down to 15%. And you have less than 4 months to comply. By January 1st, 2011, you must reduce your operating margin by that point. What's an operating margin? Overhead, employee salaries, employee benefits, marketing costs, profits to shareholders, down to 15. So the first thing Humana did was fire 4,000 employees. Right away.
Something else that's interesting too, the plan, I don't know if it's part of Obamacare, I got my own homework to do, but it's now prorated to your income level in the company. Whatever your salary is,
Yeah.
the less you make, the less you pay
Yeah.
for health insurance.
Yeah. Well, the other thing, mandates. They put 120 new mandates on. You know, that's where this free preventative care came from.
Yeah.
You see, Debbie wasn't inside the
Well, it's real thin this morning.
Yeah. Nothing's free, folks. Nothing. It may be free to the policyholder. The person paying that premium is paid dramatically more. I've showed you how much more because of this recent intervention.
I had a question about the whole thing, wasn't it that President Obama was going after the insurance company because they were making so much profit? So they wanted them to have just like a 10% margin or whatever. But the problem is with insurance companies, everything is subject to change because if you've got epidemics, if something happens, you have to pay out the cost, say, the next year.
Correct.
So I didn't
That's why
understand
they're
how
folding.
that rationale came here.
There's no rationale coming from Brockholm. But they're folding because of this.
Yeah, I know.
You know, Tammy Duckworth said the other day, this is great. Medicare is more efficient than private health insurance, right? You know why Medicare is more efficient than private health insurance? Because Medicare outsources all of its jobs to other government entities. For instance, Social Security does their premium collection, their payouts to beneficiaries. HHS does their payout to beneficiaries and marketing costs. These other agencies and the Internal Revenue Service, they collect premiums for Medicare. So you have 3 federally funded, taxpayer-funded organizations operating the ship for Medicare. You give me access to those 3 administrations as a private health insurance company to handle my marketing costs, my premium collection, my payments to beneficiaries, and I'll go down to 3% tomorrow. But Tammy just thought she had such a great thing. So I was on the phone with Joe before I go, he goes, yeah, she's saying Medicare is more efficient. I go, that's because he used 3 taxpayer funded. Joe's like, that's brilliant. He was so prepared yesterday. Yeah.
I would like to know why the media is so protective of Obama and refuses to see the truth. I mean, it has gone on since he started campaigning. It's incredible.
So, real media, real journalism in this country died with Dan Rather. It's over. When he tried to paint George W. Bush as a draft dodger and everything else, it was true that it was proven later that it was totally false. That's when real journalism in this country died. It was reborn with Andrew Breitbart. We now have a new media. And the war that's going on right now until November is a war between old media and new media. And we have to be the new media. Get on Facebook, get on Twitter. Start debating the left. Start publishing articles to expose the lies from the White House. Because every Monday, the cabal of journalists, as they call themselves, all communicate. How do I know this? How is this proven to us just this week? Just this week, CBS journalists were caught on a hot mic collaborating on how they're going to nail Mitt Romney. If he says this, then you say this. If he said that, then you say this. These are journalists. Not National Enquirer, CBS journalists. There's a cabal for Barack Obama. From Tingles of Loaded Sauce Hog Matthews on MSNBC to other more respected so-called journalists. We have to fight that battle. The other thing I want to make sure I mention to you, and I will get to you, sir. The Illinois Tea Party just got a private series of grants, donations from private entities. We now have over $20,000. So we are mobilizing until November on a movement called Let's Mobilize. And what we're doing is we have 6 House seats we have to capture and 6 Senate seats we have to capture. And the #1 response from Tea Party patriots is, listen, that's out in Plainfield, I'm in Schaumburg, gas is just too expensive. I can't pay for the gas. Otherwise I'd be there, I would help, I'd phone call, I'd knock on doors, I'd place signs. Now the Illinois Tea Party will pay for your gas. We will pay for your lodging. We will pay for your meals if you come and help people like Neil Anderson in Quincy, a patriot firefighter who needs boots on the ground. For now until November, go to the Illinois Tea Party site, illinoisteaparty.net, and click Mobilize. And Denise or Danielle, Denise is our state coordinator, or Danielle Rowe is running up this, and they'll pay for your gas, transportation, food, and lodging. You're not staying at the Ritz, but you'll stay in a nice place and help these candidates on the weekends, every weekend until November. If you can do it during the week, great. So please get involved and help that, because otherwise we're going to be living in Madagascar for the rest of our lives, or we're going to move, which a lot of people are moving.
Yeah.
Sir, your question.
Yeah, I just had a personal experience with a Canadian last winter. I go to Arizona in the winter, and one of my neighbors is Canadian, and he was telling me his experience with their thing, and he had some problems with his heart, and he got on a list, 6 months. He came to this country, had the MRI and all the tests, he did the triple bypass, had the stuff within like 2 weeks. And his worry is, now where's he gonna go when Obamacare hits?
That's correct.
Because they're not gonna be able to come over here and do that.
You know how many emails I get at truthaboutobamacare.com, besides hits from Arlington, Virginia, and Washington, D.C.? I'm more concerned about the Arlington, Virginia hits than I am the Washington, D.C. hits, but I also get emails all the time from Canadian citizens. Do you think it's going to pass? That's what I get before it passed. Now I'm getting, do you think you can repeal it? Do you think Mitt Romney and Paul Ryan will? These are Canadian citizens, because they know this is where they go. Once Canada is here, where they have to go. I mean, it's really serious. It really is. If you've never been involved in politics, obviously you guys are. But help people get involved, inform them, engage them. If you want to see how to do it, Google CSteven Tucker commits homicide. I'm not kidding. CSteven Tucker commits homicide. And you'll find a video I did, 31 minutes long, where I was at Randy Holcomb's office, and I brought my sword, which Breitbart taught us is our camera. And I engaged the left. And you'll see me in the beginning of the video saying, hey, would you guys like to debate Obamacare? I mean, you're here in the cold, it's rainy, you must believe in it. And you'll see the group of the cabal and idiots over there saying, oh, no thanks, we're not interested. And then one person does. And the next 31 minutes is a complete destruction of every White House talking point you've heard, and a replacement with facts. And I'm hitting this young man so fast, with so much information, that he's almost going into seizure mode. You'll see his eyes going like this. It's coming, you know. You got to see it, because it breaks down. And you can do this. It's not, all you have to do is spend a little bit of time doing a little bit of research. Truthaboutobamacare.com, truthaboutpreexistingconditions.com, CStevenTucker.wordpress.com, which dispels the lie that Paul Ryan's trying to kill Medicare. It breaks down the complete comparison between what Obama's plans are for Medicare and what Paul Ryan and Ron Wyden's plans are for Medicare. So that you can come back and say, hey, it's not true. Click, copy, paste, I've defeated you. Or I've educated you. It's just that simple. So, and you know, if you know you won when they call you racist. Yes.
Do you know offhand how many Senate seats are, I mean, legitimately in play? That
23. 23 Democrats, 10 Republicans. In the U.S. Senate, you're saying? Yeah. U.S. Senate, yeah. So we can easily take the Senate. We can. We just need to support these guys.
And we need, what, 4 at this point to get to that 50?
Roughly to make the 50 plus 1, yeah. So, and there's 23 Dems. Believe me, people who are worried about the outcome of this election, you should be worried. But you have to understand, in November 2010, we won 680 legislative seats nationwide. It hasn't been done since 1940. You know who those people were? Senior citizens from the town halls. They went and they voted in masses. They are not staying home this November. There's no way. Because they know they're the safety net. They're the last way to stop Obamacare. Add to them the Catholics in this country who have now been forced unconstitutionally to cover abortion in their health insurance. Add to them those who are not Catholics but are still Christian, who are diametrically opposed to funding Obamacare and being forced to pay for it in their health insurance. Add to them the small business owners who know the taxes that are coming under Obamacare. Add to them the taxpayers who know that the taxes are coming under Obamacare.
Do you know the percentage
Of what?
that's going to come off the payroll check,
Oh, I don't know.
2013?
I don't know.
Yeah, I know that there were a whole bunch of taxes involved with the Obamacare. That's what they had said, 23 or whatever.
1.08 trillion in total.
But the thing is, I mean, where can you go to find what are these taxes?
Truthaboutobamacare.com.
True.
Is that your site?
My site. Yeah. 3 years of work. And it's updated. You'll see red updates as the tyranny continues. I'll put an update in.
And you
So,
also
Oh, you can
said
read the legislation.
what?
you also included the Jews in the, you know, the Catholics are gonna be there, the senior citizens.
Oh, yeah.
But the insult to Netanyahu and
Oh, it's disgusting.
and taking Jerusalem out of.
Yeah. He's got to go. Obama's got to go. Not just for Obamacare. The man follows no laws. He's a rogue president. We have a rogue Congress.
Go see 2012 or 2016.
Yeah.
You want to be scared? Go see that.
That's right.
And for God's sakes, watch Trevor Loudon's speech. that I recorded at the Illinois Tea Party Leadership Convention. It's at illinoisteaparty.net. It's on our Chicago Tea Party site, teapartychicago.org. Watch it. I mean, it's like watching Dinesh D'Souza, but only better. Because this is the man. Trevor Loudon is the man who Glenn Beck has relied on for almost 4 years to find out who is Van Jones, who was Frank Marshall Davis. You know how they find that out? Trevor Loudon, he's a little cuckoo for Cocoa Puffs, to be honest with you. He's a patriot, but I was talking to him, I got to spend some quality time with him, all the way from his hotel to our meeting in Chicago. And I go, Trevor, how did you find this out? I mean, Beck's been using your site for 3 years. How did you find out who Frank Marshall Davis is, a registered member of the Communist Party, on the terrorist watch list from the FBI, Obama's primary mentor for 11 of his formative years? That guy. How'd you find out who he is? How'd you find out about Valerie Jarrett's and her parents and Axelrod's communist parents? How'd you find out? Steve, here's what I do. I get on a bus. After I take the blue line to the end, I go for 45 minutes, and then I get off, and I go to the Communist Library. He would go to an all-black area, not a white man for miles, by himself from New Zealand with a goofy accent, and go to the communist libraries. He did it in South Central LA, Compton, by himself. Called the taxi company to pick him up after he got off the bus, after he got his research. They wouldn't come that far. Sorry, Trevor, you have to walk. He had to walk a mile and then convince a crazy cab driver to come and get him. The man is a patriot, but he's also a little bit cuckoo for Cocoa Puffs. But thanks to him, we now know who Van Jones is. Van Jones was fired from the White House as the Green Jobs Czar because of his communist ties, because of one man from New Zealand, Trevor Loudon.
Oh, was that website, was he fired or was he reassigned?
Yeah, reassigned. You know he was fired, but they say reassigned. You know, it's like we're going to do Obama in November, reassigned.
Glenn Beck had really good focus on that too.
What was it?
Glenn Beck, when he had his television
Well, see,
show.
Beck got all his research from Trevor Loudon's blog.
Okay, that's okay.
Yeah.
That's
So the first time, Trevor told me, the first time him and Trevor met, Beck just gave him a gigantic bear hug.
Yeah.
Just said, I've been reading your stuff for 3 years. Thank you for doing what you did. But he's got a 41-minute speech you must watch at illinoisteaparty.net or teapartychicago.org if you haven't seen it yet. Trevor just goes right through, and at the end he forgets one part, so you see me as I'm holding the camera, I say, Trevor, please translate si se puede. I won't tell you what it is, you just watch the video to see what the translation of si se puede is. Anyone else?
Yeah,
Yeah.
The talk about, you know, if Obama gets defeated,
Yeah.
what's the realistic expectation that these traitors are going to go to jail, will be prosecuted or not?
I would say after they're out of office, we're not going to spend taxpayer dollars to prosecute these people. So I think the easiest, most expeditious way is to remove them from office.
But they're not going to stop, that's the problem. People know they're not going to stop.
Yeah.
And Romney and Ryan, even if we have 12-year run, because we love it,
Okay.
it's not going to go away.
Yeah.
They could be back. They'll
Oh, yeah.
always be back.
Yeah. There's not much you can do. You can either spend taxpayer dollars to prosecute every communist in Congress, which I don't think we have enough money to even do that, or you can just remove them from office. I mean, that's what the Constitution allows us to do, is to oust people from Congress who don't respect the Constitution. We did it in November 2010. 680 people who did not follow the Constitution no longer have a job, including Stupid Stupak from Michigan. Okay? 40 to 50 years of progressive communist disease has infiltrated our government. We're not going to fix it in one election cycle. It's going to take election after election after election to get rid of every one of these malcontents who do not honor our Constitution. But prosecuting all of them, first of all, we're $16 trillion in debt. We have an annual deficit of $1 trillion. Obama has added $5.4 trillion himself. We have no money to prosecute all the communists in Congress.
I say just pass a law to get rid of all the pensions and stuff.
Yeah, I agree.
Period.
Absolutely. Yeah. But, you know, it's baby steps. The Constitution only allows us to get rid of them at the ballot box. So you just do it every election cycle. And meanwhile, you support the local elections. I like, yeah, but I have a problem with term limits because what about the good people? We got to cycle out Joe in 2 years? No. Jim DeMint in 2 years? No.
No,
Well, I don't say 2
no,
years.
there's an answer to that. It's a very clever answer if it was willing. I don't see much politicians who are willing to do this. But if I'm a politician, say I have a term limit, I will not be here any longer than I said I would.
Yeah.
Okay, but this is the person that believes what I do. If you support me, support that person, and that person will come in.
Yeah.
So you have a constant,
Influx of new hires.
people, and yet you have eternal limits.
Yeah. The other day, you got Barney Franklin daggers for years. How well that worked out. Yes, ma'am.
Where do you speak next, so that we can tell other people?
Next is, and this, it's all on my site. You'll see red updates when next speak at age. But I think the next one is Saw Valley Tea Party.
Sock?
Yeah, Sauk Valley Tea Party. That's the next one. I forget what it is. I
So
think it's
what's-
22nd. No, the 22nd, I'm speaking in DuPage County. They're having a Freedom Fest, the DuPage County Tea Party. I'm speaking there. Then we have our Illinois Golf Outing. If you like to golf, please come to our Illinois. It's our first ever annual golf outing for the Illinois Tea Party. Come to that. I'll be speaking there. So the 22nd, the 26th, and I forget what I got for October. I mean, I have it up. It's up on the site, but I forget what I got. So.
Question, I see we're taping this. Are we gonna be able to, get this and
Yeah.
send it?
That's my take, and if you don't mind, with your permission, I'll give a DVD copy to anybody who wants it.
Can you do me a better favor?
Uh-huh.
Can you upload it to my YouTube site? I'll give you the passcodes. What's
I am a computer dummy. Would you have a problem if I sent you a DVD in the snail mail? Would that work?
No. Do you have a memory card in that thing?
Yeah, although there's home movie on it.
Where's Dimitri?
He's gone.
He's not here.
Oh, he's gone. Because I see Dimitri regularly. I can upload it and then give it back to Dimitri, or I can mail it back to you. But it just slides in the computer. I upload it right to YouTube. That's
Okay,
the
I'll
passcode.
figure out a way, because there's personal movie before that
Oh.
too. Nothing incriminating, but.
It's your honeymoon video. But anyway, there was a lot of speeches on Truth About
Ted,
Yes,
if you need help, I'll help you.
okay.
Good, that's good. You know how to do the memory card. You slide it, you upload it.
I'm a geek.
But the reason I told them about passcodes to my YouTube account is a lot of people can only load 15 minutes or half hours. My YouTube account allows you to upload 2-hour videos.
Awesome.
So I tell every Tea Party patron, once you record it, upload it. Like the one I gave Thursday night in Freeport is already on my site. So you can do it. And it just lets you upload. As long as you have my passcodes, I'll give them to you. Upload, you can do 2 hours. Full-length movies on my YouTube page.